Thank you for choosing Northern Westchester Hospital for your upcoming joint replacement surgery. This Northern Westchester Hospital joint replacement surgery video will help you understand your surgery and what to expect. You'll learn important information about how to prepare for your surgery and how to recover after surgery when you leave the hospital. Please watch the entire video. At the end of this video, we will ask you to confirm that you have viewed the entire video. You can stop the video at any point and come back to it where you left off. You can re-watch the video. Have a pen and paper nearby to write down any questions you may have so you can ask your surgeon. Or email questions to nwh_jointclass@northwell.edu. In this video, you'll learn about your arrival to the hospital and check-in, what to bring and not to bring on the day of surgery, what is a joint replacement, how your pain will be managed during and after surgery, how to prepare your home for the days after surgery. Each patient, as well as their family, play an important part in planning for their procedure and recovery. At Northern Westchester Hospital, we'll help you every step of the way. As soon as your surgery is scheduled, our joint replacement nurse navigator will contact you. The navigator will guide you through every step, from preparing you for your surgery, supporting you while you're in the hospital, and getting you ready to go home after surgery. In fact, planning to return home after surgery starts now. Part 1. Going home after surgery. Your goal is our goal. We want you to go home safely as soon as possible. To go home safely, you must be able to walk and climb stairs without assistance. You will practice this with your care team even before you leave the hospital. Preparing your home. Always remember, our main goal is to get you home. It is important to look around your home for items that you are used to seeing. But after surgery, many of these same items may be an obstacle. For example, area rugs, steps to get in your front door, steps inside your home, bathtub, shower, and toilet, furniture. Consider your daily activities. It's important to think about the days after surgery and put plans in place. For example, consider who is driving you to your doctor's appointment, walking your dog, cooking meals, and helping you maintain your activities of daily living, like showering and bathing. Talk with your surgeon and family members about your care at home and what arrangements are needed for your recovery time. Caring for the surgical area. Most surgeons will use a waterproof dressing for the surgical site so you can shower after surgery, but you cannot submerge the surgical site in a bath or pool. Keeping the area clean and dry is important to prevent infection. The surgical site is closed with staples or a plastic surgery closure with dissolving sutures and surgical glue. Your surgeons will tell you when you can take your dressing off, as well as when you can shower. If you have staples, your surgeon will remove them at a post-operative appointment. Part 2. What to expect at your check-in. Do not bring anything of value. This includes sentimental items and jewelry. Do bring your insurance card, advance directives, list of all medications, vitamins, and supplements neatly written to give to your care team. Do not bring your medications unless you are asked to by your surgeon. Wear loose-fitting clothes. If the plan for your recovery is to stay overnight at the hospital, then we want you to feel more comfortable and more at home while you're with us. So feel free to bring your own comfy clothes to sleep in. This is a well patient surgery, not a sick patient surgery. Of course, if you prefer to wear a patient gown during your stay with us, we'll have a nice one for you. Part 3. What is a total joint replacement? A total replacement of your hip joint or knee joint may be done because you have developed osteoarthritis in your joint. Osteoarthritis is the wearing away of the cartilage over the bone. You may be experiencing pain, decreased range of motion, and/or function throughout your day. For any of these reasons, you've chosen with your doctor to have surgery to replace the joint. What is a total hip replacement and why is it done? A hip replacement is replacing both the ball and the socket of the hip. A hip replacement consists of 4 components. 1. The stem. This is inserted into the thigh bone. 2. The head. This is inserted on the top of the stem. 3. The cup. This is inserted into the socket. 4. A plastic liner. This is inserted into the cup. What is a total knee replacement and why is it done? And what about a partial knee, and why does a patient need a partial versus a total knee replacement? Components of a knee replacement include 1. The femoral component. This is attached to the end of your thigh bone. 2. A tibial component. This is attached onto the shin bone. 3. A plastic insert which lies in between the thigh and the shin. A total knee replacement involves the replacement of all 3 compartments of the knee. In a partial knee replacement, only the affected compartment is replaced. Part 4. Pain management. Enhanced recovery after surgery, ERAS. There's no denying it. Surgery poses significant stress to your body and mind, and we want you to be prepared so you can have the best overall outcomes. At Northern Westchester Hospital, an innovative approach to surgery and pain management is called Enhanced Recovery After Surgery, or ERAS. The ERAS approach will minimize the physical and mental stress response that your body may experience from having surgery. ERAS is a process to help patients prepare for surgery. By enhancing our patients' wellness before surgery, they tend to have better outcomes after surgery. To learn more about the ERAS protocol, please watch the ERAS video. Find the link to the ERAS video at the end of this pre-surgery video. Pain is a natural response to your procedure. There are several methods that you and your care team will use to control your pain before, during, and after surgery. Before surgery, we will start your pain management early with oral medications during your preoperative phase by your nurse. The medications may include Celebrex, Lyrica, and Tylenol. Most patients will receive a nerve block by the anesthesiologist before going into surgery. A nerve block is the injection of numbing medication around the nerve. A nerve block is an excellent way to control your pain without losing muscle function and lasts for 12 to 24 hours. The anesthesiologist will also discuss with you spinal anesthesia. Spinal anesthesia is short-acting, so you will be able to get out of bed and walk soon after surgery with the help of your care team. After surgery, you'll be taken from the operating room to the PACU, post-anesthesia care unit. Your PACU nurse will evaluate and assess your recovery in the first hours after surgery. Here, your nurse will ask you several times during your recovery to rate your pain. This information helps your care team monitor and control your pain. The pain scale is 0 to 10. 0 is no pain, and 10 is the worst pain you've ever had. As you are recovering, some pain is to be expected, but it's important to listen to your body and not let your pain become severe. In the PACU, your nurse will also closely monitor your vital signs, your surgical site, and your motor function. The goal here, remember, is to reduce the amount of narcotics you receive and avoid increased nausea, vomiting, constipation, so you can get out of bed sooner. During the post-operative phase, you can either be cleared to go home the same day of surgery, or you may need to stay overnight on our medical surgical unit on the 5th floor. Staying overnight. All our hospital rooms are private rooms. Once on the 5th floor, you will have a yellow bracelet placed on your wrist. This is to alert the team that you will need assistance getting out of bed because you can be at risk of falling. All patients after surgery are considered at risk for falling, so it is important to use your call bell and ask for help before getting out of bed on your own. Your care team will care for you during your recovery on the 5th floor. Members of your care team are your surgeon, physician assistant, nurse practitioner, nurse, patient care associate, physical therapist, and the case manager. The case manager will help you prepare to go home and help arrange for any medical equipment, devices, and home physical therapy needed. If you are unable to go home, the case manager will help arrange for a stay in a rehabilitation facility. If you have any questions regarding insurance, please be sure to speak with the case manager. Again, the goal for you is to return home, but in rare circumstances, some patients may experience a longer recovery process and need extra assistance with activities of daily living. Part 5. Preventing complications. Any patient having surgery can experience a complication, although it's not common. 2 complications can be an infection at the surgical site or developing a blood clot. Here at Northern Westchester Hospital, we follow the highest standard of care to prevent all complications. One of the best things you, as the patient, can do to prevent a blood clot is early mobilization. This means the earlier you are sitting up in bed and getting up to walk, the better post-operative outcomes you will have and less chance of developing a blood clot. Some other complications may include nerve injury, vascular injury, fracture, loosening or dislocation of the prosthesis and scar tissue. Dental work. You may have heard that it is not recommended to have a dental procedure right after joint replacement. This recommendation is based on your surgeon, so please be sure to speak with your surgeon if you are planning on seeing your dentist. Some surgeons recommend a range between 6 weeks to 3 months before returning to the dentist after surgery to avoid infection. When you visit the dentist, you will have to take antibiotics before any dental procedure. Again, it is important to speak with your surgeon before any dentist visit. At Northern Westchester Hospital, we offer state-of-the-art hip and knee surgery in a unique patient-centered environment close to home. Our innovative surgical techniques reflect the most advanced, evidence-based approaches to joint replacement. Thank you for watching Northern Westchester Hospital's joint replacement video. We hope this video helps you and those involved in your care. We encourage you and your caregivers to watch this video as often as needed. Use this information and advice to speak with your surgeon about your upcoming joint replacement surgery at Northern Westchester Hospital. If you have any questions, please email us at nwh_jointclass@northwell.edu. We also offer a live virtual joint replacement class that covers this information. Our joint replacement nurse navigator will contact you to help schedule you for a class. Next, watch the ERAS patient education video. nwh.northwell.edu/pre-op.